5:08. Well, on the day, a Westminster committee has heard the state of Northern Ireland's health service is beyond crisis. We begin this evening with the story that a patient with mental health issues has spent at least 7 nights in the Ulster Hospital's emergency department. Our health correspondent, Mary-Louise Connolly, has been across this for us.
This solitary case of a patient with mental health issues being cared for in one of Northern Ireland's emergency departments sums up the poor state of the local mental health care system. The patient, who is a person, has been on the ED ward for at least 8 nights, and that's because there's no available bed in a more acceptable setting or appropriate setting with staff who are suitably qualified to support them. They're in a private cubicle, I understand, with a curtain protecting their privacy. A statement from the South Eastern Trust says it can't comment on individual cases, but that it's working beyond capacity, including in mental health, to manage hospital admissions. This is a regional problem. In fact, a report published this week by the Northern Ireland Audit Office highlights the prevalence of mental health problems here, which are approximately 25% higher than in England. The report also estimates that bringing funding levels into line with elsewhere in the UK would require additional annual funding of around £190 million.
Well, we've heard from a mental health charity which says resources allocated to mental health fall far short of what's required. Here's what Alex Bunting, the Group Director for Mental Health and Addiction Services at Inspire, told us.
We're lagging way behind other regions, and we're getting further and further away with this lack of insight and lack of investment. I wouldn't like to be put in that seat of having to make those decisions, but decisions will have to be made to prioritise mental health over other things. From I've been in this role and previous roles, we've always been playing catch up to the rest of the UK. And I think, if you think about the peace dividend and the options and the opportunities we had to really make a difference with mental health in this country, we've missed that opportunity, and we now need to review how we do that.
Well, the patient is being cared for in A&E because there are no available beds in any of Northern Ireland's dedicated mental health units. The South Eastern Health Trust said it was working beyond capacity, including in mental health, to manage hospital admissions. Well, Sara Boyce is campaign organiser with the human rights organisation PPR and is currently working on a campaign called A New Script for Mental Health. Sara, I'm glad to say you've joined us in the studio. Tell us first of all about how you feel about all of Northern Ireland's dedicated mental health units being full.
Yeah, I mean, it's very shocking, and the story that you've covered about the man spending more than 7 nights in a bed in A&E, really shocking and upsetting to hear about that. Obviously traumatising for that person and their family, but also for the staff working in ED. It's no place for somebody in crisis or distress. But I suppose the thing for the campaigners that we work with in New Script for Mental Health is that we keep hearing these stories. These are not new stories, and we know that things are getting worse. Also, this predates COVID and the current budget cuts that we're hearing so much about and they're talking about in Westminster today. It does feel to campaigners like it's been a permanent crisis in mental health. Going back, we have people in the campaign for almost 20 years now who've been trying to fix the existing system. So I think for listeners, probably people are saying yet again, reading this and hearing this every week after week, what is going so badly wrong with our mental health service? Why is it failing like this? And the question that we're raising this evening is it just about money? Yes, we know that the budget is woefully inadequate, but do we need to be asking some deeper questions here? And there are 2 things just I want to flag up that have been that we've found out about in the last week. One is in the report, the BBC report, the Audit Office report yesterday on mental health. For us, the most significant thing in that report was not about budgets and funding. It was their conclusion that the Audit Office basically said they were unable to conclude as to whether mental health services here are providing value for money. And the reason for that is they don't have the data. They don't have the outcomes data. And that's a pretty gobsmacking finding from the Audit Office. Like, what that means in plain English is that we don't actually know, the government doesn't know if the money that they're putting into mental health services across the piece, are they actually working? And that is really deeply concerning. And the other thing alongside that is there was a court judgment on the 11th of May where the RQIA were found that for the last almost 15 years, they had a legal duty to inspect community mental health services, and it just wasn't happening. They haven't gone near mental health services since 2009. And this connects directly back to this experience of people being left in A&E. We haven't had any oversight or regulation of mental health services. Again, something really shocking. And then I suppose we're looking at it and wondering, well, where is the Permanent Secretary in the absence of the Minister? Where is Peter May? Where is the Chief Executive of the RQIA, Breach Donaghy? We haven't heard anything. These are two very serious matters. And if we don't look at, you have to kind of, I think, zoom back from each issue, like the man who's been left in a bed in A&E, to try to make sense of it. So I think until we start looking at that, you can't make sense of it. And can I just...
just want to sort of just on the RQIA, because that's something that we will certainly follow up, and we'll try to contact them just to get some sort of response from them on that, because I noticed it on your Twitter feed a little bit earlier, and that's very interesting and something that we need to pursue. But when it comes to the new script for mental health, what are the solutions then? What are you proposing?
Well, I guess the solutions, and it's coming. One of the things we've been doing is asking people for what their new script would be, asking individuals, because everybody's script is different and it's based on your own experience and wisdom. And we've had about 200. They're on our website, and the overriding theme coming through, there are many and varied, but the big thing coming through is people want choice, and they want to be involved in making decisions. So our system at the moment, one of the campaigners described it recently. She said it's like all you're ever offered is pills and a bed. Now, we're not saying pills and beds aren't necessary. They are. We know they are. But if that's how it's characterised, if we can only boil our mental health approach down to pills and a bed, it's not working. The UN have said this, the World Health Organization have said this, that we need a new approach to mental health. So that's essentially what New Script for Mental Health is about. It's opening up a conversation, but bringing people into, because for too long, I guess, it's been psychiatrists and accountants who have made these decisions, really significant decisions, like Alex was talking about earlier, around where funding goes. Really important. But yes, we need to get more funding, but we also need to have a conversation that involves people around how that funding is spent.
Because quite often that is the issue. It's we can ask for more money, but actually it's how that is used, or how services are put together in the most efficient way. But if I could take you back to the Audit Office report and the fact that it couldn't reach conclusions, does that, in your view, amount to a failure of the system when it comes to dealing with mental health in Northern Ireland, when a place that we know the needs are much higher than other parts of the UK?
Absolutely. For us, it's a huge failure. It's an absolute dereliction of duty, as is the RQIA failure to inspect, because having information and data is an absolute basic. How do you develop services, and what are you basing your services on if we don't even know what works or what doesn't work? And we saw during COVID, there was no problem about getting data. We had the COVID dashboard, which was absolutely excellent and won awards in the same Department of Health. Why do we not have data on mental health services? There was a huge review done 2 years ago by the UK Statistics Authority, and they're highly critical, saying, we're in the halfpenny place compared to other jurisdictions around mental health data. So it is a scandal, and that's only one issue. I mean, that's of a system that really is not fit for purpose. So I think we need to shift radically away from it and start having conversations about what might work better.
Yeah, and I just wonder, because we've had weeks and weeks and weeks of reporting on cutbacks and speaking to organisations. Do you get the sense, Sarah, that there are people out there, that there is now a kind of groundswell, there's a motivation for people to try to fight some of this, to try to say, actually, this is unacceptable?
Yeah, absolutely, certainly in communities, and the people in the campaign are people with their own experiences of mental health, people who are carers, but also mental health professionals who are being harmed by the system as it is. But we're having people coming to us increasingly wanting to get involved for that very reason. But it's also for us about joining up the dots. There's a protest at City Hall tomorrow around the cuts in services, because it's on the ground that we see it. We can't mental health in and of itself doesn't make sense. You need to connect it into the things that are driving distress and trauma in people's lives, like poverty and discrimination, housing stress, the situation for asylum seekers, the hostile environment. These are all the things that we need to start joining up the dots around. But there's huge determination within communities to take this into their own hands, because the system, the state and it hasn't worked. So I think people are increasingly saying we have the solutions. We need to get on with it here.
Sarah, thanks very much indeed. That's Sara Boyce, campaign organiser with the human rights organisation PPR. Really appreciate it.